three vaccines are the most important of them for feline health is the combination distemper and upper respiratory vaccine. And that one needs to be given, depending on who you talk to, and nobody knows for sure, anywhere from every 1 to 3 years in young cats. I tend to opt for every 3 years in young cats, and if he hasn't had one since he was a kitten, then he should probably have one today, okay?
Okay.
The rabies vaccine is optional for cats in San Francisco. Some municipalities require it by law, others do not. And San Francisco is not one of those municipalities.
Okay.
The rabies vaccine is not administered for his health. It's administered for human health because rabies can be spread to human beings.
Right.
The rabies vaccine is controversial in cats because it has been linked in about 1 out of every 10,000 cats who receives it with a type of cancer at the injection site.
Okay.
It is your choice whether or not to give him a rabies vaccine. He is, in my opinion, at very low risk for rabies, being an indoor-only cat at this point. There hasn't been a rabid cat in San Francisco, I want to say, in 25 or 30 years.
Okay.
That said, if he ever bites somebody, legally speaking, your life will be easier if he has a rabies vaccine. And if if he ever catches a bat that flies in through the window, which sounds preposterous, but it does happen about every 10 years in this city, a rabid bat will fly into a window and a cat will be exposed that way. And so those are the sorts of possibilities. Most people I know with indoor-only cats do not get the rabies vaccine for their cat.
All right, good to know.
The other vaccine that is widely accepted as being effective and potentially useful in cats is the feline leukemia virus vaccine. Feline leukemia virus is a disease that is genetically related to HIV. Unlike HIV, or the human AIDS virus, it's not contagious to human beings. Unlike HIV, it's very highly contagious, and it is a disease that spreads among cats who go outside. Cats who are kept indoors are at virtually no risk for leukemia. Like the rabies virus vaccine, the virus for feline leukemia has been correlated with the cancer at the injection site in about 1 out of every 10,000 cats who receives it.
Okay.
So, I would, my general recommendation is cats who don't go outside, I don't recommend that vaccine.
Okay.
There are a number of other vaccines out there for diseases ranging from Bordetella, which causes some respiratory syndromes in animals, to Giardia, to ringworm, to feline AIDS, none of which are very widely accepted in the veterinary community as being very effective.
Okay. Well, I say yes on number 1 and no on props 2 and 3.
Makes sense to me. Well, without any further ado, let's take a look at him.
Okay, let's go, buddy.
I've been watching him while we've been talking. His behavior is completely normal for a cat here in the hospital.
Good.
He's kind of trying to figure out a way out of here. Hey, I get nervous when I'm at the doctor too. All right, but he's bright and alert. He's not showing any signs of sensory or neurological deficits. And I've noticed he's made several good jumps. That one excluded, but there was a keyboard in his way. But he's navigating the room in a normal fashion. His coat is really good. He does have the forest cat face, which is a very handsome configuration for a cat. Not that I've ever met an ugly cat. If you look at his eyes, they're both clean and clear. The pupils are symmetrical and they respond normally to light. I don't see any redness, swelling, or inflammation or discharge. He does have a very mild amount of gingivitis. If you look at his teeth here, on this tooth in particular, there's a little bit of gum recession on the tooth. And there's a little bit of redness right where the tooth meets the gums. Now, this is the most common problem I see in 4-year-old cats. He has a very mild situation here. He's right on the cusp of needing anesthetic dental work. I would probably try brushing his teeth first. This is the most affected tooth in the mouth right there. You can see just a little margin of red. Okay, bud.
Yeah, it's all right, buddy.
This is something that will be progressive. If you're able to brush his teeth, you might be able to halt or reverse this process.
Okay.
Otherwise, what's ultimately going to happen is probably within the next year or two, he's going to need professional dental work.
Okay. Wow.
Good. So this here is nice and clean and pink. I see he's been tattooed.
Yeah.
That is a common phenomenon in cats, but there's no redness, swelling, or discharge there. That ear looks good too. His patience is wearing thin. That is not abnormal.
No.
Hey, bud. You want to check this out? You want to sniff? Nah, a little tentative whiff there. He thought he saw his moment. So I'm listening to his heart. He has a normal heart rate and rhythm. There's no heart murmur. His respiratory rate is normal, and his respiratory effort is normal. I do not hear any abnormal lung noises on his left side. in between grumbles, I don't hear anything abnormal, that is. His weight is perfect. He's neither too heavy nor too thin. Obesity is a really emergent problem among cats and dogs in America.
Mm-hmm.
What I'm doing now is feeling his abdomen. I'm feeling for any organs that are too big or small, any masses, anything that's painful or irregular. So far, nothing's wrong. Both of his kidneys are smooth and symmetrical. They're kidney-shaped, and they don't feel shrunken or irregular. His intestines are smooth and regular. I don't feel any masses or tumors. His spleen is normal in size and shape. He has a little bit of urine in his bladder. That is not abnormal. Now, I'm sorry, my friend. I know we just met. Everything looks normal back there. And lymph nodes feel normal. Okay, there we go.
Wow, that was a dismount.
Yes, indeed. That's a very normal physical exam, pretty typical. Actually, a little bit better than average. Most cats his age will have more dental disease than he has, and a lot of cats will be developing weight problems by the time they're his age. I definitely do recommend toothbrushing. Okay. What type of diet do you feed him?
Well, right now he was on a dry food diet. Royal Canin was the brand that I was using in Sweden. But getting him over here, I got in the habit of sort of feeding him some wet food as well, so he's still on that too. Okay. I did that especially right after the flight because I thought, you might be dehydrated, you might need it, and then I've just been spoiling him ever since. What do you recommend?
That's a can of worms sort of question.
Yeah, I know.
Nobody knows for sure what the best food is for cats, and there's heated debate about whether dry food is better or wet food is better. Some people believe, although the evidence is kind of lacking for this, that dry food contributes to the development of diabetes in cats. However, wet food definitely contributes more rapidly to the development of dental disease. Diabetes in cats, like diabetes in humans, is very heavily correlated with obesity. In a cat who's not overweight like he is, I would go with dry food. Okay. I can't promise that it is absolutely the best food, but based on what I see with him, that's what I would recommend.
Okay, great. Hey Taylor, how's it going? Alright, so we're in the middle of our checkup. Taylor seems to be doing alright, apparently I gotta brush his teeth, which will be fun. He's gonna love that. But he's in good shape. We're gonna get a respiratory vaccine. We're not gonna get the rabies vaccine or the feline leukemia vaccine. And then we're gonna have him tested for feline leukemia and AIDS. And then he's gonna get a microchip.
This vaccine protects against certain respiratory ailments, or helps to protect against certain respiratory ailments. It's not a surefire thing, but it is very effective against the feline distemper virus, also known as feline panleukopenia. That's a real common problem in kittens. It's less of a problem in older cats, and certainly we wouldn't want to consider giving this vaccine again any sooner than in 3 years.
Okay.
This may make him lethargic for the rest of the day.
Okay.
He could also be sore at the injection site.
Okay. All right, so I don't know if he was sore from the shot, or is still sore from the shot, but lethargic, I think we can go ahead and say that he is, if that's not a pretty lethargic dude. What's up, buddy? Yeah, he's pretty tired. But the trip was a success. I didn't film anymore at the clinic because I was pretty busy today, so they took him in the back. They, I was going to say installed his microchip. Is that what you say? They implanted his microchip, so he's got that now. And they took some blood so they could test for both feline leukemia and feline HIV. And I called Dr. Barchas just a few minutes ago, and he said that both tests were negative. So Taylor's first trip to the vet in the United States, success. It went well. I think he's happy to be back, though. This is pretty comfortable place for him to be right now. All right, Taylor, wave bye-bye, bye-bye.